In the United States, 1.5 million people are living with or in remission from a form of blood cancer. Many of these cases are B-cell lymphomas that often develop in adults older than 60, but can also be diagnosed earlier in life, such as the case as Astrid, a young woman who was diagnosed with lymphoma at age 29. Now, she's joining us today alongside Dr. Matthew Lunning, hematologist at University of Nebraska Medical Center, to help raise awareness of B-cell lymphomas this September during Blood Cancer Awareness Month. You have to forgive me, doctor. Yes, I'm a little bit of a Nebraska fan. Together, they will discuss the prevalence and impact of this disease and the important role treatments called CAR T-cell therapies can have for certain patients. Good morning to both of you.
Good morning. I was waiting for a go big red.
Well, between Nebraska and Colorado, I have to be careful there. So
All right.
you got to be careful, but go big red. So, Dr. Lunning, tell us about blood cancer, and is there a particular type you're here to discuss with us today?
Yeah, thank you. So I'm a blood cancer doctor. I specialize in lymphoma, and I was part of the clinical trial development of Breyanzi, a CAR T cell. And both Astrid and I are here today compensated for our time by Bristol Myers Squibb. Diffuse large B-cell lymphoma is the most common non-Hodgkin's lymphoma. Non-Hodgkin's lymphoma makes up over 60 different kinds of lymphomas. Diffuse large B-cell lymphoma is a very aggressive lymphoma. Patients often have symptoms of increasing size of lymph nodes, which live throughout the body. Many times patients have symptoms and present to the ER or even diagnosed after their symptoms in the hospital. The median age is about 66 years of age, but can span, younger generations, as you'll hear in Astrid's story.
Well, speaking of which, Astrid, where does your journey with blood cancer begin, and what impact has it had on your life?
Yes, as you mentioned, I was diagnosed when I was 29. I was in the prime of my life, getting through my master's program, recently married, when I started feeling itching all over my body, 6 months prior to my diagnosis. And then all my symptoms started to come after that with night sweats, fatigue, chest pain, back pain, and ultimately I ended up in the emergency room where they found a huge mass inside my chest, and that was found to be large B-cell lymphoma. At the time, I was shocked to hear the news, especially at a young age. But then I quickly started aggressive chemotherapy for about 6 months. And unfortunately, after I was done, my cancer came back pretty quickly after that. So that's when my doctor mentioned two options for me. One was stem cell transplant or CAR T cell therapy. And I decided to enroll in a clinical trial with CAR T cell therapy at the time.
So, doctor, what advances in treatment have been made for people with this blood cancer, and what is CAR T cell therapy?
Yeah, you heard it in Astrid's story. So many times patients with large B-cell lymphoma are given upfront chemotherapy that can be quite intensive with the intent to take it away and never have it come back. We call that in oncology curative intent. Unfortunately, 40% of the time, patients either have relapse of their large B-cell lymphoma or it never goes away after the frontline therapy. And in that situation, for 30 years, we've been trying to give them more intensive chemotherapy and what we call an autologous stem cell transplant. So that's using the patient's own stem cells to rescue the bone marrow after high doses of chemotherapy. With CAR T cell, which is T cells, part of your immune system, that are removed from the patient, sent away, and re-educated by some re-engineering to hopefully make them more potent and stronger killers of the patient's lymphoma. So often they are reinfused through the same vein that they're pulled out of after that education. In the clinical trial called the Transform trial, Breyanzi went head-to-head, toe-to-toe against that 30-year-old standard of care of high-dose chemotherapy and an autologous stem cell transplant. And in that trial, 75% of the patients achieved a complete remission. And we already knew from later lines of therapy with the utilization of CAR T cell that if you could get into a remission, those remissions could be durable. And that bore out in the primary endpoint of the trial, which was event-free survival, meaning patients were alive without their lymphoma and not needing further therapy. But CAR T cell therapy is not a walk in Central Park. You can see cytokine release syndrome, you can see neurotoxicity, and you need to be monitored for secondary cancers. So if you choose to get a CAR T cell therapy, it is incredibly important to stay with your healthcare team.
Astrid, what eventually led you to consider CAR T cell therapy, and what advice would you offer to others who may want to know about CAR T cell therapy?
After hearing that my cancer had come back, my family now were devastated. And I just left it up to my oncologist to give me the best treatment. I had a wonderful team that I trusted and gave me the confidence to move forward with this therapy. And the first 30 days after receiving my T cells, I was very fatigued. I couldn't even walk up the stairs to my apartment. But then months after that, I regained my strength, and by 6 months, I was told I was in remission.
Doctor, where can someone go to learn more about this personalized treatment option?
Yes, one of the locations you can go to is breyanzi.com. So the spelling isn't intuitive in the name, so I'll spell it out for you. BREYANZI.com.
Dr. Lunning, Astrid, thank you so much for joining us on Morning Blend. At this point, I will say go big red. But I also got to say something else, Dr. Lanning. It's very interesting to me because I'm part of the startup community here in St. Louis. And we always talk about startup and innovation and this and that, but you talk about medicine. There are so many things happening in medicine as far as research, innovation. It's just crazy. Talk just a little bit about that if we have time.
Yeah, no, you're absolutely correct. Even if we think about just immunotherapies of where CAR T cell, lives, I could almost show you, a satellite picture of what is the space of research in immunotherapies, and you think that they're just satellites hovering around the Earth. But in reality, those are all of the novel new ways we are trying to combat, not only lymphomas, but other different types of cancer. So I think that really we're just, shepherding in this therapy through CAR T cell to really learn how we harness the immune system to better fight cancer.
All right, instead of saying go big red, I'm going to say go Dr. Lunning. Thank you so much for joining us on Morning Blend. Thank you.
Absolutely. Thank you for the invitation.
Thank you for having us.
Thank you again.